Hello everyone, I am Dr. Vipin Sisodia. I am a consultant urologist and a kidney transplant surgeon working in Yatharth group of hospitals in Noida and Greater Noida. Today we are going to discuss about prostate. Prostate is a gland that is present in males usually at the junction of bladder neck and urethra. It has a very specific functions. It secretes some fluids in young patients that helps in the constitution of semen. It had some functions that are usually required PSA, it secretes PSA that will help in liquefying the semen. As the age increases, the prostate also increases in size. And after increasing in size, it creates some problems for the patients. So we are going to discuss these problems and then we will see what we are offering the services to you. First of all, the prostate when increased in size, it is due to the increase in the number of cells. That is called benign prostate hypertrophy or BPH, hyperplasia. Second thing is the incidence of this disease in the adult males is usually it starts after 50 years of age. At around 50 years, around 20 to 30% patients will have this incidence. As the age increases to 80% of the patients will have the symptoms and signs that you associate with benign prostate enlargement. So what are the signs that are there? A person who is above the age of 50 or 60 will usually complains of he has to go multiple times in the night to pass urine. He has to wake up every time to pass urine. That is the most frequent complaint that we used to hear in our OPDs. Number two, patient will say you will have complaints of decreased urine flow. You have to exert some force while passing urine. Patient will feel urgency. As soon as he has an urge to pass urine, we have to go to pass, and otherwise the urine will come on the clothes and the clothes will become dirty. You have the flow of the urine has decreased with the increasing age. This is not normal. This is not normal. This is a disease that we are normally thinking that is normal for the age. As my age has increased, so my flow has decreased, but it is not normal. Some patients will have difficulty passing blood in the urine, but that is also associated with prostate. But it should be ruled out other causes also. With all these problems, we usually diagnose prostate. When you will come and visit our clinic, what the test we will do, we will examine your prostate by doing a digital rectal examination in which we will examine your prostate through your anus. We do ultrasounds, uroflowmetries, the flow of urine, and to see how much is this. Sometimes we are also doing PSA. PSA is done to see how much it is. It usually is not signifies prostate cancer. It is a very common misnomer. If PSA we are dealing with cancer. No, PSA is increased in so many conditions, including cancer. So we are doing PSA just to rule out that part also. There are guidelines for that, and we are following the guidelines. If all these symptoms are present and all the investigations have been done, and patients require treatment, 90% patients can be treated with medicines. Medicines are there, alpha blockers are there, anticholinergics if urgency is present, 5-alpha reductase inhibitors are there to decrease the size of the prostate. With all these medicines, and all these medicines are very, very uroselective. These are new medicines have also come now. These are very, very selective, having very, very few side effects. So with the medicines, around 90% of patients will get treated without having any surgery. Now the surgeries that we are offering in our setup, we are doing TURPs, we are doing bipolar Hall, TURPs, we are doing laser enucleation of prostates. Prostate surgeries usually are in the market. It is there. There's so many complications are there. It is usually not so many complications are present, but yeah, surgery has to be offered when it is indicated. The indications of surgeries are very straightforward. Patient is not voiding in spite of getting medical treatment, that is failed medical treatment. You are having obstructive uropathy, that means the body salt, the creatinine level is increasing in spite of, because of the prostate. That means you have to go undergo surgery. Patient is having complaints of bleeding while passing urine in spite of taking the drugs that we are giving for prostates, and recurrent urinary tract infection is an indication for surgery. About surgeries, in HOLAP or holmium laser enucleation of prostate, we will go from the urethra, normal penis route. We will use the laser and we will enucleate the prostate. Very, very less bleeding. I think within a stay of a day or two, patient can be discharged. Results are excellent. Excellent means excellent. The other thing is bipolar TURP is coming. The disadvantages of monopolar TURP has been overcome by this bipolar TURP. Chances of bleeding, chances of prolonged surgery complications are very, very less. Hyponatremia, post-TURP syndrome has decreased with this. So I think we are offering a lot of services regarding prostate in our setup. So if anybody has any problem, you are free to call us. Thank you so much. Bye-bye.